Hi, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative cellular therapies. So the topic today is a question we get from time to time. How do you prevent cell line contamination for your stem cell procedures? So I'm going to go through on the whiteboard here the three areas where we know contamination could occur and how we prevent that from happening. All right, so the first one is with regards to the donor. Okay, we use umbilical cord tissue that is donated after a scheduled C-section procedure. So here's an example of a donor, Donna the donor. Okay, so it's women who are under the age of 35 who are undergoing a scheduled C-section. So thank you, Donna. Thanks for your help there. So we need to know if Donna has any risk factors, right? So there's a 210 question questionnaire that Donna fills out, and she's consented and agrees to be a donor. Now, these questions are very in-depth. Do you smoke? Do you vape? Any history of opioid abuse, recent travel, tattoos, heart disease? I mean, the whole family history, okay? So this needs to be reviewed by the medical director of the lab to make sure that the contamination part is very, very, very low risk. Then there's also some disease testing when the umbilical cord tissue is obtained. And, you know, here's a typical umbilical cord. This is plastic, it's not real. But there are some samples from the tissue sent out to a third party to look at HIV, syphilis, HTLV, CMV. It's a very long list of diseases. So that is what happens from a donor perspective. Then you move into the processing, okay? The labs, I'll put this down, the labs that we have are aseptic, and they have very, very, very low particle counts. So ISO 5 is what we abide by. We have real-time particle counters. We check it every 10 minutes. We look at humidity and temperature. And so we make sure that the chances of, and we also test during processing to make sure there's no contaminants in the room. Okay, we have an open petri dish. All right, so we abide by GMP, which is an international GMP, GLP. It's an international designation where you're making sure that you follow good manufacturing practices, and that comes to both the reagents that we use, no animal reagents, nothing that isn't produced at a GMP certified facility, and then for their quality control. So certain things that we have to test for every time we do processing to make sure that there's a very, very low incidence of contamination, okay? Quarantine means whenever we finish processing of stem cells, we put all those products into a quarantine freezer. It keeps the stem cells viable, the protein structurally intact, but it gives time for us to send out samples, a lot of samples, to a third party to look for bacteria, virus, fungus, and endotoxin. And all that testing takes about 2 weeks, okay? And then it all comes back. And if anything is positive or abnormal, the whole batch gets discarded, okay? So we don't take any chances when it comes to the sterility testing, the bioburden, things like that. So once all of this is complete, we produce a certificate of analysis. Patients are welcome to see that, and basically it lists the sterility testing, the disease testing, a few other variables, and then our medical director signs off at the bottom for that, and they also sign off on the donor test questionnaire as well. Now, the third part, I'll switch, is during the procedure. So it's all for naught, all of this is for naught if you're not going to do the procedure well. So our providers follow aseptic technique where you're going to want to make sure that the area that's being worked on is thoroughly cleaned with betadine, alcohol, swabs, any sterile draping that's necessary. And then make sure that everything used is disposable, right? Nothing is reused at any of our centers around the world. whether it's a micro needling tips for facial treatment or hair treatment. Everything is sterile out of the pack and then discarded afterwards. So that sums up the 3 areas where we prevent cell line contamination, procedure contamination, any of that. We've done over 24,000 procedures in the last decade. We've had very, very successful and happy patients, 85% patient satisfaction. Knock on wood, I don't know if this is made of wood. We've never had a deep infection or a disease transmission or a rejection of stem cells. So look at our website today at r3stemcell.com and then call us at +1 for the USA, 844-GET-STEM. Be happy to set you up for a free consultation. Thank you.